All right, guys, first example of the day. Let's do top to bottom, bottom to top. But in reality, what we're really doing, and remember, gravity is limited. It's a persistent little bugger, as they say over the pond. But gravity is limited, meaning when my feet or legs are on my left side, gravity is trying to do something different to me than when my feet or legs are over on the right side, okay? So in other words, the trick is that the motion is the same going from left side to right side. The motion is the same. But once we tip it over midway, gravity's trying to do something different to me. So if gravity changes what it's trying to do to me, then my muscles have to change how they're trying to do what they do to me, okay? So let's look at and analyze muscles of the trunk. Agonist, who's in those agonistic groups? Contractions and motions. Last bit of remembrance. We do not say pelvic girdle rotators. We say pelvic girdle rotation, but we can't say pelvic girdle rotators because it could be muscles of my right hip. It could be muscles of my left hip. It could be muscles at both hips. Or in this case, it could be muscles of my trunk. In other words, those muscles can be different. Unlike my elbow flexors who are the same, my plantar flexors who are the same, my hip flexors who are the same. So when we're talking about influencing pelvic girdle rotation, we have to bring the muscles back to the consistent muscles that would be spinning the basketball, whether that's the trunk in this case or the hips. Does that make sense? So in other words, I could say my right hip extensors are allowing my anterior pelvic girdle rotation. That's okay. But it's my right hip extensors who are consistent muscles that I know. All right. So this is a trunk muscle conversation. These trunk muscles are influencing both trunk motion and pelvic girdle rotation. And we're going to have an open-ended conversation to see if you can tell me the muscles and the contraction, bringing the legs up, letting the legs go down, bringing them up, letting them down. Make sense? Let's start with that position in the top. And I'd love for you to go across, nice and easy, and then bring it back. And then we'll stop. Here's a hint, maybe you don't need it, but always start isometrics. Isometrics the easiest to identify. So in that top picture, his legs aren't laid to the ground, so isometrically, he has to be working to maintain that position. Maybe starting off isometrically can help you see who he needs, and then from there you can go with the motion that you want. And then there's other things. Oh, also, is anybody looking for part-time job work? I don't know, I ain't hired. But a former student of mine sent me a message about hiring for anybody, PT, PA, personal training. I'm gonna post it on my class Instagram page. But I could also send it to you if you email me. The name of the place is the Stretch Zone. They're looking for anyone looking to gain hands-on experience with patients, personal trainers, PT, aspirations, PA, all the above. Main task coming into the clinic, performing passive stretching routines, authentic areas for that person's dealing with the words. So I'll post the information on our KNES 310 415, and then if you have follow-ups, I'll put you all right, do y'all need more time, or are we ready to go over it? Are you ready? All right, 2 ways to look at this, and don't do the shortcut unless you're confident you can do the shortcut. The first way is the long way, which is the consistent way. It's one we've always done it in. What is gravity, or the external force, trying to do to my pelvis? It's trying to spin my pelvis to the left. But because I'm analyzing trunk muscles, I need to look at it as what's gravity trying to do to my trunk? And gravity is trying to twist my trunk to the right. If gravity, and this is the trick about elimination, if gravity is trying to twist the trunk more to the right, I don't need muscles that are also trying to twist the trunk more to the right. I need muscles that are trying to twist the trunk to the left. Therefore, I need left transverse trunk rotators. Who are the left transverse trunk rotators? Right external, left internal, left erector. The cheat code in this is that your obliques show with the angle of the legs. Like, I need right external and left internal to yield the pelvis back this way. Does that make sense? I'm giving that practically to show you why you would need muscles that are trying to reach around to your pelvis and pull the pelvis like this. I'm trying to show you how it would be right external, left internal, who are left transverse trunk rotators. But instead of traditionally trying to bring your right shoulder, your right ribs to your left hip, it's reverse. It's trying to bring your left hip to your right shoulder. Cool? So concentric when you come up. But then once you tip over, gravity's not trying to do that same thing anymore. Once your feet tip over to the right side, now gravity's trying to twist your trunk to your left. So because gravity is trying to twist your trunk to the left now, you don't need those same the muscles that are trying to twist you to the left. Now all of a sudden you need muscles that are trying to twist you to the right. Same concept, but it's just as an example of think of it like this. If I was doing a shoulder exercise, a straight arm bent over. In a flexed position, if I'm here, gravity's trying to extend me, so I need my flexors. But if I'm here, gravity's now trying to flex me, I need my extensors. So Doing a whole range of motion would be extensors, 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 flexors, 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 flexors. That was one range of motion of flexion. But my agonist switched as soon as gravity was trying to do something different to my shoulder. The same concept, just here. Okay? So left transverse trunk to bring you up, right transverse trunk to lower you down, concentric to bring you up, eccentric to lower you down, concentric to bring you up, eccentric to lower you down. Now, what are some of the limitations of this exercise? Not the limitations. I mean, there's pros and cons of all exercises. One of the limitations is that you don't work those muscles concentrically and eccentrically in a full range of motion because of that flip over, because that switch that you flip midway, meaning that I'm working my left transverse concentric to midway, but I don't work those same muscles concentric from, like the whole range of motion. Does that make sense? So that's why you may, again, use different exercises, machines or something where you could use the same agonist for an entire range of motion, because the machine is trying to do the same thing to you, do that entire range of motion. It's just a limitation of gravity. We love gravity, but you're limited. Does everybody feel more comfortable about this question? About the Now, listen to the keywords. If I asked you which specific, or I'm gonna say which of the following muscles was responsible for bringing her elbows all the way up to her knees. In other words, which of the following muscles was responsible for that entire range of motion? Could everybody see that any of our trunk muscles couldn't bring her all the way up? Like your trunk flexion is actually very limited. Like you don't, because you have all the wiring and stuff. That's hip flexion is what brought her up more than anything. Does that make sense? In other words, if you're just using your trunk, you'd be doing crunches. That's what I'm trying to get to. You'd just be doing crunches. Crunches aren't going to get you all the way. We're good. Now again, I'm never going to be like, you should never do this exercise. It's not about that. I'm just teaching you how muscles influence motion through contraction. So it has nothing to do with, well, I thought you shouldn't do sit-ups. It's not that's not this kind of class. So bringing her up, we're looking primarily at hip flexors, right? Gravity would be trying to extend her. She would need hip flexors. So on the test, if I said, which of the following muscles was most responsible for that range of motion, bringing her all the way up? And I would say like a rectus femoris, a semimembranosus, a rectus abdominis, and a rector spinae. That's how we can eliminate the rectus. The rectus only does this. We don't need the erector. The semimembranosus is an extensor. We need flexors. Just kind of giving you some insight on how these questions could be. Which one would be concentric, bottom to top or top to bottom? Good, good. Hip flexors, doing the hip flexion through concentrics, and then lowering down the hip flexors, doing. Hey, Mike, I'm in the middle of class. Can you call you back? Thanks much. Mike he's a real good dude. He runs a children's charity up at the Shreveport area. Real nice guy. So do we need to follow up? So you identify the agonist. And then your circles or your lists or seeing who's in the front helps you to say these are all the muscles that pull in the direction of hip flexion. When hip flexors do hip flexion, concentric. When hip flexors do extension, eccentric. All right, what type of questions would you like more of? We got time. Is there a specific area of the body that you know you have questions on that y'all want to do? Stretching or ankles? Yeah, yeah. Okay. Do you want like a muscle question for the ankles? Okay, let's see. Trying to find something I haven't done before. All right, top to bottom, bottom to top. Muscles influence motion through contraction. So give me some muscles, assess the motion, and confirm the contraction. Oh, I forgot to tell you guys, I'm gonna try to scoot 310 out of here by 8:25 on Wednesday, meaning if you're ready to go, you have your stuff up, all you have is your tablet or your computer to take your test. I'll let you start writing on your scratch paper 5 minutes before the test starts. In addition, I'll give you 5 sheets of paper that I'm gonna pre-staple as like a little booklet. So when you have all kinds of room to write, to draw, whatever you need. Okay, so you can't take advantage of that extra time if you're not here, but if you're here 5 minutes early, I'll let you get started on any of that kind of stuff. Remember, the more time I give you, the less questions I get to give you. So it's a tough place to be. I want you to have enough time, but I also want you to have enough questions. Does it make sense why I keep saying it over and over, and maybe it's just me, why we want to look at muscles from a pull? Because that can be transferred into motion. Like it makes sense. If something's pulling this way and I see motion that way, there's something unique about that. If something's pulling this way, but I see motion the other way, there's something unique about that. So that's why we're trying to always bring it back to pull so that we can make sense of the contractions. Because just tibialis posterior doesn't really tell you a lot about high pulls. All right. What is the TheraBand trying to do to my ankle? Plantar flex me. Do I need muscles that are also trying to plantar flex me? No, I need muscles that are trying to dorsiflex me. Those are called dorsiflexors, and those cross anterior to the front of the ankle's bilateral axis. So how you learn who they are, that's up to you, but you need to know it could be the tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. That's in the group that pulls in the direction of dorsiflexion. We know, so those are the muscles, great. When we go to contraction though, I want to bring it back to glute pull because it helps me to see it in the same language. Dorsiflexors are going to do dorsiflexion through concentrics, and dorsiflexors are going to allow plantar flexion through eccentrics. So from top to bottom, I observe dorsiflexion. Dorsiflexors, dorsiflexion, concentric. Bottom to top, I see plantar flexion. Dorsiflexors, plantar flexion, eccentric. It's the same muscles. Same muscles affect different motion through different contractions. Something's got to change if the motion changes, but it's not the muscles, it's their contraction. It's how they work that changes. See if I can find another angle. Got that one. So let's do this one. Sub-Taylor question. Remember, just because all your circles, all your appendicular circles are of right side, super easy to do a left-sided exercise because the muscles are the same. So once you identify the agonist on the left, it's the same muscles as your circle on the right. In other words, if you identify you need left hip flexors, those muscles are the same on the right side. If you finished early, think of the next kind of question. Whether it's a joint, a stretch, just you tell me what you want. I'm like your biomechanical barista. Well, someone's stepping on the band probably to keep the band from flying off. So it's like they're stepping on it to create stability. Some study sessions set. Good.
So it's just not to do
Once you know how to play the game, it's fun to play. It's fun to get on the court and play. Like I said, the best way to study, I mean, some people may think it's weird. I don't think so. You pop some popcorn, you get a lawn chair, you go to Planet Fitness, you just sit, you just watch people, you know? Just it. Ladies, you all good? All right, that TheraBand is trying to do what to the subtalar and transverse dorsal joints? Evert, outstanding. If the TheraBand is trying to evert me, the last thing I need are muscles that are also trying to evert me. Right? So I would need inverters. Your circles or your lists, or again, visually, it's the muscles that cross the subtalar on the medial side, on the inside. Those are tibialis anterior, extensionalis longus, peroneus tibialis posterior, flexor hallucis longus, flexor digitorum longus, the medial crossing muscles. If my inverters are activated or innervated and I observe inversion, concentric contraction. If my inverters are activated and I observe eversion, eccentric contraction. You guys know, and I'm going to toot my own horn here, but it's not because it's the best horn. I think it's the most consistent horn. No one teaches it like this because I see it differently than other people. And to me, if you have a consistent process, that's what will get you right answers. Is the process is consistent. The examples change. The people change. But the process stays the same. Okay? All right, how about we do one where it's one of those exceptions where you got to move faster than gravity or faster than the external force. I think we've done one of those before where, you got to smush the bug, or I think we also did one with running. Okay, so let's talk about running. Let's talk about sprinting specifically. Okay, so I don't need to show you a picture of this. We're senior KNES students. So while someone is sprinting, it makes sense that their hips are going to cycle between extension and flexion. You can have flexion and you can have extension. In addition, you're going to have to speed up flexion, slow down flexion. Speed up extension, and then eventually once you push off, you got to slow down that extension. Does that make sense? So we're on the same page? Okay. So now what I'd like for us to do is have a discussion about what's responsible for each of those four phases. Speeding up my hip flexion, who would do it and how? Slowing down my hip flexion, what speeds up must slow down, who would do it and how? Speeding up my hip extension, who would do it, how? Slowing down the inevitable hip extension, who would do it and how? And when I say who would do it, that's my agonist. And the how is the contraction type. I'm telling you the motion, muscles, motion, contraction. I'm giving you the motion, flexions and extensions. And then we're saying what speeds up must slow down. I got to speed up my flexion, I got to slow down my flexion. I got to speed up my extension, I got to slow down my extension. So 4 categories. Speed up the flexion. What group, how did it contract? Slow down the flexion. What group, how did they contract? Speed up the extension. What group, how did they contract? Slow down extension. Speed, who did it, how did they contract? Go. Right, you guys, check this out. Speed up hip flexion. It doesn't matter what gravity's trying to do. If we're trying to sprint, like gravity, thanks for your help, but you can't do the motion that I'm trying to do at the speed I'm trying to do it. That'll come more into play on the extension part because gravity's trying to extend you. But I just want to plant that seed. So speeding up the deflection, hip flexors, I'm shorthanding it here, through concentric contraction. Makes sense? I gotta make that flexion happen as fast as I can. Now the same muscles, this is why in 310 I emphasize so much, muscles only pull, muscles only pull, muscles only pull. The same muscles that shorten to speed you up can't push you to a stop. They can't push and pull. And gravity could slow down deflection, but again, very limited. Gravity is a very persistent, but a very weak force. So when it comes time to slowing down the flexion, I want to turn these flexion pullers off, and I want to turn on these extension pullers. I want to turn these on to put on the brake of flexion. Does that make sense? So slowing down the flexion, hip extensors, eccentric. Now those hip extensors, we get a little bang for our buck. Because again, it's tough. Turn this on, turn that off, on, all these light switches and electricity. But we get to turn something on and have it stay on for two different reasons. So we get a good return on our investment. The same muscles that are slowing down our flexion can stay on to change our direction and speed up our extension. That's what we call plyometrics. That's what plyometrics is. Plyometrics is a sequence of contractions where the muscle is putting on the brake, slowing down, and then changing direction and speeding up. Make sense? So speed up hip extension, same muscles, but through a different contraction. And this to that is what we call plyometrics. Those hip extensors are going to speed up the extension. We're going to hit the ground, but those extensors still on. Those extensors are going to help push us forward. But what speeds up must slow down. So we got to slow down that extension once our foot comes off the ground. The extensors can't do that. The extensors can't push me to a stop. Gravity can help slow down my extension, but again, gravity is very weak. So we are going to use our hip flexors. And I think I told you last class, that's the limiting factor to how fast you can run is your hip flexors. Being able to put on the brake and as quickly as possible reset the hip so that you can go back and do it again. So slowing down the hip extension is going to be my hip flexors. Through eccentric. And then we get right back to where we started, speeding up the hip flexion, hip flexors. And the reason I did this is to show you the plyo. So what's the plyometric sequence for your hip extensors? Slowing down the flexion followed by speeding up the extension. What's the plyometric sequence for your flexors? Slowing down the extension followed by speeding up your flexion. The reason I introduced you to levers and that kind of stuff is because you have specialty muscles that are in that group that are very good. They are specialists when it comes to slowing down or speeding up. So slow down muscles, braking muscles, have much more of a second class function. In other words, they cross the joint and insert very far away. Like the rectus femoris would be a great slow down muscle, putting on the brake, trying to stop that big old leg from moving back. but it wouldn't be a good speeder upper muscle. A good speeder upper muscle, which is totally a scientific word. Speeder. That'd be like the iliopsoas, right? The iliopsoas, which inserts very close to the hip, all it has to do is contract a little bit, get a big sweep in range of motion. Same thing for our hip extensors, right? The hamstrings, when I'm going to slow down the flexion, pull very far away from the hip. Great at putting on the brake. And then other muscles like my gluteus maximus can help speed me up a little bit. So that's what I want you to notice. We have certain muscles that cross our joints, but some of them insert closer than others. Some of them insert more far away. And they get to shine. They get to shine when it comes to these rare instances of function where we're going as fast as we can, trying to speed things up, slow things down. Muscles that insert very far away, great for slowing down, great for putting on the brakes. And muscles that insert closer to, more third class, are great for sprinting.
Oh, that's so rare. Like, what's that thing? What they call during custom.
Yeah, that's why you have certain, that's why you see certain strains in similar in muscles. So like it's like a hip flexor strain more often than not is a rectus, because it's breaking hip and breaking knee. It's really putting the brakes on your whole leg. But doesn't it make sense that I can break the hip and the knee? If I could put on the brake at the same time, it's going to really help to slow down the leg momentum, right? So it's being stretched at both ends, and that more often than not is what's going to strain it. Hamstrings, we did this one last week. More often than not, when a punter punts, they're going to pull something in the back of their leg, right? It's not the muscles that made the foot go fast. It was the muscles that had to slow the foot down. And so when you're speeding up the hip flexion, the hamstrings are being lengthened. And when you speed up the knee extension, the hamstrings are being lengthened. And you got all that momentum that has to be stopped. Because what's the alternative? Letting my leg, I think this is a decent analogy. If I let my leg whip without muscles kind of putting on the brake, I might run the risk of hyperextension, and then I'm going to tear my ACL. So it makes sense that when I'm reaching the end of my row, my hamstrings, especially because they're trying to slow down my whole leg, hip and knee, those muscles have to really yank to prevent my knee from going too far. Does that make sense? So that's when you would have hamstrings. So hamstrings, rectus, these muscles that insert at multiple joints that are really advantageous for braking, because when you put on the brakes, that's eccentrics. When you're slowing something down, that's eccentrics. The rope is being pulled apart, the TheraBand's being pulled apart. You never pop a rope by shortening the rope. Anytime you snap something, it's because it's being pulled apart. Does that make sense? And it's the same thing with muscles. When you have a muscle strain, delayed onset muscle soreness, or a rupture, it was literally the muscle was pulled apart and then went beyond its yield. So on the test, I will not get into any more than there's a sprinter. What would be a muscle that would speed up the hip flexion while they sprinted? And the type of contraction to speed up the hip flexion. And I might say rectus femoris through concentric, gluteus maximus through, I'm going to give you a flexor, I'm going to give you extensor. Slowing down the hip flexion. I'm going to give you a flexor, I'm going to give you an extensor. Slowing down the hip extension. I'm going to give you a flexor, I'm going to give you an extensor. Like I'm going to keep it in that context. See what we got. We haven't done a stretch yet, huh? How about we do some stretching? All right, guys, let's analyze hip. Whoa, let's take a picture. Good. Means we got pixels. All right, let's talk about hip. I would like for you to talk about. First of all, let me help. Let me help you. Help me. Let's see. Yay! It's a good picture. All right, so hip sagittal, so that means flexion, extension stuff. And then hip transverse, that means rotational. Okay, so left hip, what would we be stretching sagittally and what would we be stretching transversely? And right hip, what would we be stretching? Say that forward. What would we be stretching sagittally and what would we be stretching transversely? And then feel free to look at the knee position to apply. Wow, with these muscles, even though they cross the hip, they will be stretched a lot because of the knee position. Like you can have a follow-up conversation about subsequent knee position. All right, you guys, right hip. Do we agree that her position, she's flexed and externally rotated?
Yes.
Okay. Now, the gluteus maximus is an extensor and an external rotator. So she's getting some glute stretch, but because it's externally rotated, it's not as tight as maybe what it could be. But that doesn't mean you're not stretching. I just want to be clear. Like just because something isn't optimally stretched or stretched as much as it could, doesn't mean it's not getting lengthened. It's a continuum. All right. That's like me taking the TheraBand and doing this. And the TheraBand stretch, all I'm saying is that it could stretch a little. Right? It's not like you wouldn't feel it in posterior. Right? All right. Hamstrings are being stretched too, but that knee position is really slacking them off, right? So in other words, if she were to extend that right knee, she'd get more stretch. I'm not saying she should or shouldn't. This isn't a class for you should or shouldn't. This is just me trying to teach you mechanically how these muscles are affected by different positions. Okay? All right, let's go to the left. Her hip is extended, so she'd be stretching her hip flexors in that plane. Her knee being flexed is great for the rectus, right? Her rectus would be getting a little extra because it's being lengthened at the hip and it's being lengthened at the knee. Now again, she could probably go a little further. Looks like she's pretty flexible. So I'm not saying that it couldn't go further, but the fact that her knee is flexed does get some extra stretch on that rectus. Probably, if we want to go deep into the radical, I wouldn't ask this on the test, but we're playing. In addition to being extended, because sometimes these combinational motions have to happen, especially with the hips, because you don't have as much mobility. But you could say she would be abducted as well on that left hip, and so therefore she'd be stretching adductors. Because her knee is flexed, that gracilis would probably be less stretched than the other traditional adductors that just.
Would you say that you're turning the rotator?
Yes, absolutely. So the hip being internally rotated, she would get some stretch on that on those external. Probably not so much the gluteus maximus though, right? Because she's extended, it would be on slack back there. But all of those other little lateral rotators. So in other words, this stretch you should justify all those little obturators, camella, all those. But her piriformis and her glute probably not as much because the piriformis is an ab, so she's in that kind of ab and position, so it probably wouldn't get as much stretch as. But then you notice every conversation we had to clarify this plane, this muscle, this one piece at a time. And that's how I would ask it. I would ask, is the rectus being stretched at the hip and the knee? Or, which one isn't affected by the knee? Which one is affected by the knee? I think it would be very specific. I'd never give you this as an open-ended essay question. Just say, tell me what you see. All right, guys, y'all study, and on Monday we'll have our final review before the test.